Knee pain is a common symptom that causes people to go to see their doctor. In fact, 25% of people in the United States report knee pain. Your knee pain may have started with a traumatic incident, but it's not getting better. Or it may have just gradually started over time and it just continues to get worse. You may have been to your doctor who told you to rest and take medication, but that didn't work. So when you went back, they did an x-ray and the doctor said you have knee arthritis, but your pain started suddenly, and you know that knee arthritis develops slowly over time. So is it really the knee arthritis that's causing your pain? And you may have spent way too long resting, only to finally get the pain to go away, go back to your activity, and find out that the pain was still there. Today, we are going to discuss the different tissues that are in your knee so you can understand what tissue is potentially causing your knee pain. Now, to be clear, we're not going to be discussing a whole bunch of exercises and things to do about knee pain, but the goal of this video is to help you understand what's going on with your knee pain as well as what caused it in the first place. But I promise we will do those other videos soon. But first, a public service announcement. This is really important as you're discussing knee pain. You see, the knee is a hinge joint, which is a pretty simple joint. It's not super complex. It doesn't have a lot of different motions. So basically, your knee can straighten and it can bend. It can straighten and it can bend. There's also a little bit of rotation that happens in there, but that's getting a little bit too complicated. If you think about it just as a straight off hinge joint, you'll be better served. And the reason why this is important to consider is the fact that your knee pain may actually be caused by either your foot or your hip, your SI joint, or your low back. You see, if you had a direct injury, you fell on your knee or something like that, then yes, of course, it could be one of these tissues that we're going to discuss in just a minute. However, if your pain came on slowly over time, it may be that there's been some abnormal forces that are going through the knee that are either coming up from the foot or down from the hip. And this is really key, because a lot of people, when they're trying to figure out how to deal with their knee pain or even seeking help for their knee pain, are only having their knee actually looked at. You have to find someone who is going to look at the whole system to understand why these structures that we're about to discuss are painful in the first place. Okay, so what are the structures that could be causing your knee pain? The first tissue we're going to discuss is tendons. These are flexible cord-like structures that connect muscle to bone. And in the knee, the biggest one that people know about is the patellar tendon, which connects the quadricep to the tibia or the shin bone. Many times when people are struggling with a tendonitis, they'll have pain in that area, they'll have swelling in that area. They may even have difficulty bearing weight, such as walking, because they feel decreased stability. The next tissue we're going to talk about is ligaments. Ligaments connect bone to bone, and there's four main ones that we find in the knee. There's the ACL, which many people have heard about, and there's its partner, the PCL. Those are inside the knee joint. Now, on the outside of the joint, you have the MCL, which is the medial collateral ligament, that's on the inside of the knee, and the LCL, which is the lateral collateral ligament, which is on the outside of the knee. These ligaments can get damaged either by an acute injury. You may have heard of soccer players or football players getting ACL tears. But they can also be affected by overuse. So most commonly what I see in the clinic is an MCL injury, and that is that ligament that's on the inside of the knee. And it's because when people are walking, they're putting increased force through that medial knee. And this causes it to kind of stretch out over time and eventually become painful. People who are struggling with a ligament injury often complain about a lack of stability. That may even happen before they have pain. The next tissue we're going to talk about is cartilage. Now, cartilage is like this thin rubbery substance that lines the surface of the joints, and it keeps the bones from jamming down on top of each other. Very important tissue. However, if there's abnormal forces through the cartilage, it can wear out over time, and that is what will lead to arthritis. If you've ever seen an x-ray of a healthy knee joint, there's a lot of space in between the femur, which is the leg bone, and the tibia, which is the shin bone. However, if you've ever seen an arthritic joint, you can see that there's decreased space in there because the cartilage has been worn away and replaced with arthritis. People who are suffering with cartilage issues often have pain that actually increases with rest. You see, when you're up and moving around, you're actually getting some nutrition to the cartilage, and so it doesn't hurt as much. But when you're sitting and resting, it tends to get more aggravated. One thing that a lot of people don't know about is the synovium. So there's this joint capsule that's around, well, every joint, but right now we're talking about the knee joint. And on the inside is this lining that's called the synovium. And this can get irritated, especially when there's something else already within the joint that's irritated. This can lead to warmth, pain, stiffness, swelling, and just the general signs of what you consider inflammation. The tricky thing is that the synovium is irritated usually by something that's going on inside the joint, and it could be because of a systemic issue like rheumatoid arthritis. And the last tissue that we have to discuss in the knee is bones. So you've got that femur, which is that thigh bone. You've got that tibia, which is the shin bone, and you've got the patella, which is the kneecap going over. And you've got that kneecap, which sits on top. Obviously, bones can be subject to issues and they can fracture, which can cause a huge amount of pain. Now, most commonly, if you have a fracture in that, you will be inherently unstable, usually unable to walk or stand, and there will be an excruciating amount of pain. Please, if you believe that your knee pain could potentially be due to a fracture because you have a recent fall or injury, I highly encourage to seek care from a medical professional who can do an x-ray, who can make sure that that's not your problem. And if it is, to treat it appropriately. Now, assuming that you are not struggling with an acute injury issue that you can point to and say, that's what started my knee pain, you may be wondering, but why did it start overall? And what I can tell you most commonly that I see in the clinic is that people have an abnormal gait pattern or an abnormal walking pattern that has been going on for years. And this has put increased stress to the knee, that has stretched out the ligaments, that has caused abnormal tension through the tendons and the muscles, that may be starting to develop some arthritic changes because of the compression through the muscles. And it's this cycle that people get into. In that case, what is the root cause? Well, the root cause is the tissue that's actually causing the pain. However, why is that tissue causing pain? Well, it's causing pain because you're not walking normally. So in order to treat that situation, you have to treat not just the root cause, but you have to treat what's causing it in the first place. And this is what I commonly see with patients who are struggling with arthritis, is that the pain has come on over time. They've been told that the cartilage is worn down, but they don't understand why. So what we need to do for them is not only treat the cause of the pain, which is the arthritis, but we need to treat the issue that is leading to the arthritis. You see, many people believe that knee pain is unavoidable with aging, or you may have been led to believe that it's because of activities that you did when you were younger. What I can tell you without a doubt is that the research is super clear. Just because you're older or you like to do high intensity exercise, that does not necessarily increase your risk of knee pain. In fact, the research has shown that that may actually help to decrease your risk of arthritis. It's important to understand not only the root issue of your knee pain or what is causing that knee pain, but why that tissue got irritated in the first place. Again, if you have an acute injury, you probably know, you can point to that event and say that's what caused it. However, if you don't, and this is an insidious onset or it came on over time, it's really important to understand why the tissue that is now being painful is causing that problem in the first place, which is why we do a full evaluation when we're in the clinic to understand how all the other tissues are affecting that knee. So we're going to look at your feet as well as your hip, your SI joint, your low back. We may even go further up the spine if we need to understand how all of these forces are collaborating together. And for all of my friends who don't live in the Maple Valley, Washington area, we have an option for you. We have our online health coaching where we will sit down and discuss all of this and your story in more detail to understand what started your knee pain, as well as giving you the next best step on your journey to help reach your goals. Now, if you're looking for some safe exercises to do with your knee pain, I'm going to link a video here for the best exercises to help decrease your knee pain.